Welcome to Providing Virtual Care to Clients and Families, a webcast by the Regional Learning Centre. My name's Marcia. I'm a community educator and I'll be presenting the webcast today. The transcript of this recording is below for your convenience. Providing virtual care is a skill which most community staff have had to learn quickly. We will be covering the basics of what to consider when connecting with clients virtually. When we talk about virtual care, this includes phone calls, video conferencing calls, emails, and secure messaging between staff and clients and their families. Due to the quarantine measures implemented by the government, we had to adapt our in-person care to the online world. Agencies have come up with creative ways to connect with clients and their families using technology. Staff have been using phone and video calling for check-ins, medication requirements, assessments, and activities. Some agencies are also hosting calls with groups of clients for exercise programs and social events like virtual coffee. And this is in addition to their one-on-one calls. Agencies have come up with many different ways to continue to support both clients and caregivers during this challenging time. Policies and procedure documents are typically what we turn to guide our practice. But as the quarantine measures were put in place so quickly, staff have had to start connecting with clients virtually before these documents were created for a virtual care practice. Some existing policies still are applicable to virtual care. They need, however, to be updated or supplemented with new documents. When it comes to virtual care, it is important to review and be familiar with your agency's policies in general. Some policies related to documentation and privacy will be applicable to providing virtual care until your agency has specific policies and procedures related to virtual care. Review policies regularly, as they may be updated frequently as the situation evolves and new government direction is given. Things are changing almost daily, so it's important to stay up to date on what your agency expects of you. Speak with your team and supervisors about any gaps you see in your policies and procedure documents to ensure that they are comprehensive to cover all aspects of your care. We need to meet the same requirements for virtual care regarding informed consent as we do with in-person care as per the Healthcare Consent Act of 1996. Clients and families need to be provided consent in order to receive virtual care. In order to get that informed consent, clients and families need to have a clear understanding of a couple of things. First off, what their service will look like. How exactly will you be providing care virtually? If the client is participating in more than one program, how will each of these programs be facilitated? What does the client require in order to participate? A computer, phone, Wi-Fi requirements, all of this needs to be discussed with the client. They also need to know the limitations of virtual care. What care cannot be provided virtually? They need also to be informed about what your agency has put in place to protect client and family privacy and confidentiality. Some clients may decline virtual care because they are worried about protecting their privacy in the online world. You want to be very clear about what your agency is doing to protect the privacy of clients. They also need to know how their records will be stored and shared with other team members. Again, as part of protecting the client's privacy and confidentiality, you want to be clear in telling clients and families how their information will be kept and protected as they receive care virtually. And this consent that they provide needs to be documented in the client's record. You also need to ask for consent with any change in service or service delivery. So this includes any changes in the kinds of programs in which the client wishes to participate. If the client wants to participate in a new group exercise program that your agency is offering, you need to obtain consent from the client before enrolling them in this program. You need also to consider health literacy. Consents need to be informed, which means the client and their families need to understand all the above information, as well as the outcomes if they choose to or choose not to give consent. This information needs to be given to them in a way that they can actually understand. Consider how you are obtaining consent for virtual care. Written information about the program needs to be at a grade 3 to 6 level. Information provided verbally should not include any acronyms or jargon. If English is not the client's first language, consider using an interpreter to assist in getting informed consent if the client needs it. Privacy and confidentiality are important to consider as we connect with clients virtually. Just as with in-person care, the Personal Health Information Protection Act, or PHIPA of 2004, needs to be followed. When conducting client interactions, it needs to be a private setting by considering both the physical and the virtual space from which you are connecting. So with the virtual space, you want to consider the room. Use a private room in your home with a door that closes to ensure no one passing by can see your screen or walk by and overhear your conversation. You want to use a headset with a built-in microphone so only you can hear the client and you can speak at a lower volume. Again, to lessen the chances that others in your home can overhear the conversation with your client. Let others in your home, such as your children, partners, parents, roommates, know that you're on a client call because you don't want anybody walking in and interrupting you. Also put your pets in a different room so they too will not interrupt you. With technology, you want to think about using password protected devices. Ensure your laptop, tablet, or phone has password protection so that only you can access it. Using password protection platforms for virtual connections as well. There are many different video calling programs and platforms that you can use to meet with clients and families. You want to be careful in choosing one that uses passwords to ensure only your clients can access the meeting. Also be sure to check if the platform automatically saves and stores a recording of your meeting in the cloud, since you may not know who will have access to that recording and in turn, who will have access to the client's information. Ensure that you're using a secure internet connection. The internet relies on electronic copying of information for transmission, and this creates the possibility of interception at many different points. Don't borrow your neighbor's free internet. Rather, use your own and ensure it is protected with a password. Protecting a client's privacy and confidentiality requires a joint effort between your clients and you. You can do everything on your end to protect their information, but if the client doesn't use secure internet connection or turns on their speakerphone for your conversation, then there could also be a breach of privacy. Therefore, it's important to clearly explain to your clients and families what is required of them to protect their privacy and confidentiality when they consent to virtual care. Clear introductions are necessary. Always start your interaction with clear introductions. State your name, your role and agency, and also confirm the client's identity. For clients with a cognitive impairment and who have many providers involved with their care, these introductions are really important. This is particularly important if you're conducting a phone call or the client has turned off their video during a video call. If you're calling a client to speak about a sensitive matter, make sure you ask the client if they're ready to have a confidential conversation before doing so. Staff have encountered situations where clients have been short, have given vague answers to their questions during a call, which wasn't typical of that person. It wasn't until later in the call that the client shared that they were in a room with their family and didn't feel comfortable to speak openly because their family was present and listening. To avoid this, Ask your client if they have a space where they feel comfortable to speak openly during a confidential or sensitive matter conversation before you jump into the topic. Some clients connect with service providers while taking a walk, and this can also ensure their privacy. Clients may want their families in the room with them during your call. So in this case, ensure you know who else is in the room and document this information in the client record. As agencies are using different platforms to connect with clients, ensure that your client is comfortable using the technology and the particular platform that you're using before you start your call. Walk through the features and the functions of the platform so that you can tailor it to their experience. Do not leave your connection unattended or set it to automatically answer the call. You want to remain on the phone or the computer for the entire duration of the call to ensure that you're the only one connecting with the client. When the meeting is over and you're disconnecting, ensure the client disconnects from the call before you close the session. Doing this will ensure that the client doesn't stay connected inadvertently, which can also leave their microphone or their camera on as well. It's important to review how to disconnect the call with your clients, especially as this may differ from each platform that they're using. Some require you to close the window, and some require that you click end call. Do not record any sessions with your clients. If you must record a meeting, you must tell the client that you are recording, and this recording becomes part of the client's record, so it needs to be securely stored. Disable cameras and microphones when not in use. And this can be done by disconnecting the power, the connection cords, or using a lens cover. Emails can also be used to connect with clients and families as we provide virtual care. It's important to consider that email is not a secured way to communicate. Emails can be easily snooped and intercepted by hackers, internet service providers, and others. Emails can also be accidentally sent to the wrong individual. Therefore, you need to remind clients not to put sensitive or confidential information in their. If you're sharing your computer with others in your home, be careful with accessing your emails. Ensure you sign out of your email at the end of each workday. Only use your work email to send emails to clients and families. In order to increase email security, you can use a security software. Your work email likely has security and encryption already built in. This is another reason to use only your work email to communicate with your clients and their families. You also want to ensure these security considerations with clients and families. If they will be communicating with you via email, as privacy and confidentiality are joint responsibility for both of you, you want to inform your client and their family about these particular pieces about email. If you're sending emails to a group of people, ensure you use the BCC to address the emails. When you put email addresses in the to line, everyone in that email chain can see everyone else's email addresses, meaning that you would be sharing the email addresses with everybody in that email. And this could be an issue because you need permission from clients to share their email addresses with others. So this actually could be a privacy breach. So to hide everyone's email addresses, use the BCC, which stands for blind carbon copy. Do not post anything about clients on any social media platform. This is a breach of privacy and confidentiality. Consent to do this. Using technology to connect can make your interaction with clients and families feel impersonal. You want to make a conscious effort to connect with your clients in a meaningful way. Doing so can make the client feel supported and help you build on your therapeutic relationship with them. So think about how to stay client-centered or person-centered with your care. Use what you know about the client from your in-person interactions and bring that into your virtual connections with them. For example, share a joke or an activity with them over the phone if that's what they did during your time together in an in-person setting. Make time during your meeting to ask clients about what's new in their lives. There could be hobbies or interests that they've started. Staying up to date on what's important to them can help you further tailor your conversations to be person or client-centered. It will also help you to continue the connection once the in-person services are established again. Your verbal communication, think about how you are speaking, your tone, your volume, and your pace of speech. With nonverbal communication, think about your body language, your posture, your eye contact, facial expressions. Your nonverbal communication is particularly important if you're connecting with clients using video. Clients can see how you're looking at them, down at your notes or off the screen, which can send the message that you're not listening or not interested in what they're saying. If you need to be looking off screen or down at making notes, be sure to tell clients that you'll be doing this and tell them that at the beginning of your meeting so that they're aware of what's coming. Nonverbal communication is important even if you're making phone calls as well. Studies have shown that you can hear if the person on the other end of the line is smiling, even if you can't see them. So consider your nonverbal communication even when you are on the phone with a client. Give your undivided attention to the client. Do not multitask. Close your email and other windows to eliminate the risk of being distracted during your meeting. If you're going to be searching something for a client, let them know that you're on the computer to search what you require to give them the information. Show empathy and practice active listening. Paraphrase for understanding what the client says and ask for clarification if something is unclear. Connecting with the client using whatever technology they have access to and are comfortable using. If the clients don't have a computer or don't want a video call, find a way to still be able for them to receive your services and participate in your program. It is about keeping the therapeutic relationship and the connection and providing the services to the clients that they require. Some agencies have done drop-by visits where they have dropped off information for clients in order to still be able to connect with their clients in a virtual manner. As we're now providing care virtually, our home and work lives can start to blend together, but it's important to remember to stay professional. Some ways of doing this can be by setting clear boundaries for your work hours. As you're now working from home and checking your phone and email regularly, clients and families may feel that you're always available and accessible to provide support. It's important to clearly communicate to your clients and families what your working hours are going to be while you are working from home. You also have to follow these boundaries by not answering emails or calls or responding to phone messages outside of working hours. You need to also set clear expectations for communication. Let clients and families know how you would like to communicate with them and how you would like them to communicate with you, whether it's by telephone or email. And tell the clients and families how long they can expect to wait for a response from you. Consider your physical space of your setup for your virtual visits, particularly with video. You're connecting with clients in your home. And if you make video calls, you want to think about what clients and families can see in your home during the meetings. Take a look at what's behind you. What can be seen in the video? Are there any personal pictures or items that you don't want people to see? If so, you may want to move them to another spot in your home, angle your camera differently, or even apply a fake background. And some of the video platforms offer this. Always use your work cell phone to call clients and their families. If you don't have a work cell phone, ask your employer if they can supply one for you. If you must use a personal cell phone, change your settings so that your number is hidden and it appears as a private caller. If you're not sure how to do this, then Google your phone type and you'll be able to get the instructions. If you have to use a landline, dial *67, wait for the dial tone, and then dial the client's number. Again, it will show as private caller. So if you're going to be using these forms of communication, you want to inform your clients that you will be calling as a private caller. Some clients and families do not pick up the phone if they see private caller. So you want to let them know this before your call so that they actually will answer the private caller phone calls. You want to also limit personal stories. You want to be careful with sharing the personal stories as it shifts the focus from the client onto you. Only share your personal stories if it can help you build a therapeutic relationship with the client. While providing virtual care, you will be expected to continue documenting in the client's files. In addition to making notes of any changes with the client or their care, you also want to ensure that the files are up to date. To do this, you want to periodically check with the client to ensure that you have the most correct contact information for them, their place of residence, and other information that you keep in the file. You also want to refer to your agency's policies for direction in how it's expected that you store and update these files. You may be expected to update files in an online platform or keep written notes on paper. Files must be kept secure at all times and stored in a place where no one else can access them, such as in a locked filing cabinet or password-protected file on a computer, or in a password-protected cloud system. You should not store client files on a personal computer. If you make any notes about a client during a visit, these notes become part of the client's files and must be secured. If you need to destroy clients' notes or records, you need to follow your agency's policies on destruction. You cannot just toss these notes into the trash. They can lead to a privacy breach if they're found by others. Team communication remains important. Even though you're working in a different space from your colleagues, you're still working together to support and care for your clients. It's important to communicate regularly. Regular communication is important with your colleagues to ensure that everyone on the team is on the same page and up to date with changes in delivery or any changes at your agency. Client safety can also be maintained through regular communication. You can maintain a sense of team connection. It allows you to check in and support one another, and it gives you an opportunity to discuss any concerns or problems and continue to solve them as a team. Thank you for watching this webcast. Hopefully this has added to your knowledge of how to provide care virtually. There is a link below to an evaluation, so please take a few minutes to complete it and give us your feedback on this webcast. You can also find additional resources listed below to support you in providing virtual care. Please contact the Regional Learning Center if you have any questions or suggestions for virtual further webcast topics. Take care of yourselves and be kind to one another. We're all in this together and we need each other to cope. Thank you and stay safe.